thank you so much, David, and thank you everyone who's joined us today at this very early morning hour in the United States. My name is Dr. Vladi Dvoyris, and I'm the VP of Digital Information at AbraCadabra Implants, not the CEO. The CEO is here with us in the audience. And today we're going to explore how AbraCadabra is revolutionizing implant dentistry, and more specifically, implant-supported restorations, simplifying complex restorations, empowering dentists at all skill levels, and ultimately transforming patient care. And on that optimistic note, let us begin. So, AbraCadabra, you might say it's a strange name for a dental company, but it actually derives from the Hebrew phrase AbraCadabra, which means I shall create as I speak. So it's almost biblical. It reflects our commitment to innovation, creativity, and purposeful action. And our mission is divided into three parts. We want to disrupt the implant-supported restoration industry. We want to repair the world one denture at a time. And we want to make expert-level solutions accessible to everyone, both dentists and patients. These guiding principles, which are inspired by the Jewish ethos of Tikkun Olam, drive us to create solutions that heal and improve the world. And in the world of dentistry, Tikkun Olam means developing solutions that address the shortcomings of existing treatments and empower dentists to provide exceptional care. I'd like to introduce you to Jay. Jay is a 60-year-old woman who struggled for years with traditional dentures. She was fully edentulous, and speaking, eating, and smiling were for her daily challenges due to severe bone loss and financial barriers. And she believed that fixed teeth were out of reach, and she must go with removable and very uncomfortable dentures until she discovered our products, until she discovered AbraCadabra. Our telescopic magnetic restorations, requiring only a minimal number of implants, offered her an affordable solution without compromising on quality, comfort, or functionality. Here you can see her abutments. These are her actual abutments in the making. And now let's hear what Jay has to say. So first, she wrote this, that I have been able to eat food that I did not eat in years. I'm so happy. She lives without the fear of her dentures slipping or causing discomfort. She speaks, laughs, and eats with ease and confidence. And as a matter of fact, we asked her to demonstrate how easy it is to place the magnetic dentures and take them out. So here's the denture.
And
I hope
those notches will hook into the magnetic plates. Voila!
Okay, it's so easy. It took the dentist exactly 2 minutes to teach her how to do it. And removing the denture is as easy.
Okay, so we're going to take the bottom teeth out, which have magnets. I'll just hook under there, and I'll hook under there, and out they come.
Now, when these dentures are in the mouth, they behave like natural teeth. They're stable, they're functional, they're convenient, and they do not rock and they do not fall out. So aside of Jay's personal story, I believe that this illustrates that quality, affordable dental care is a fundamental right. We believe everyone should have it. And it's not about teeth, it's about restoring quality of life, and basically restoring life itself. Now, every great innovation starts with a vision, and our vision began with Dr. Jan Arel, whom you can see here in the middle, that after decades of implantology practice, as a matter of fact, he was one of the first implant dentists in Israel, he recognized the inefficiencies in implant-supported restorations. Then he teamed up with Dani Younisian, who is a certified public accountant and a former IAF combat systems officer, and together they decided to found AbraCadabra and bring this vision to life. And later I joined the team to lead the development of our digital solutions. And together we've combined clinical expertise, technological innovation, and business acumen to redefine as a team the field of implantology. So what do we do in AbraCadabra? Our telescopic and magnetic abutments address three critical challenges in implant dentistry. First, the inherent angles of implant placement due to anatomical constraints. You must place the implants where there is bone, and there's often not enough bone to place the implants completely straight. Secondly, we need to be flexible to manage and withstand the occlusal forces, the forces that act on the implants and the prosthetic components while we chew. And third, we need to balance between passive seating of the restoration on the one hand and its retention, the ability of the restoration to stay in place and not come out every time we chew or speak. By solving these issues and by achieving this fine balance, we can offer stability, protect the bone, and ensure long-lasting restorations. Our system eliminates common frustrations in dentistry. First, it provides unparalleled stability through telescopic and magnetic retention, ensuring restorations remain secure. Maintenance of the restorations is reduced to zero, saving time and money for both the dentists and the patients. And perhaps most importantly, our system empowers every dentist, regardless of their experience, to achieve expert-level results consistently, time and time again, in every case. Our telescopic magnetic system is already functioning in the mouths of patients. Each component is digitally planned for precision, paired with standardized parts and delivered as part of a simple, repeatable workflow. This eliminates the complexity of extensive catalogs and streamlines the process for every dentist. And you can see here in the illustration that you can place the implant at practically any angle, and we will still have the abutments pointed at the right direction and parallel to each other if there are more than one. And usually there are more than one. So here's how it works. First, the dentist scans the implant level using a digital impression, a digital scanner. You can also take a normal silicone impression. Then our own proprietary CAD software, we call AbraCad, automates the planning process with unparalleled accuracy, and I will say a few things about that a bit later. And finally, the dentist uses a single workflow to restore every case. So even the most challenging cases have the same workflow. This includes misaligned implants, this includes previously failed restorations, and even implants that were fractured, for which we also have solutions. And we do that, we achieve this level of precision by utilizing something that other dental software does not. So if any other dental software that labs use these days, they just copy traditional methods like sculpting and waxing, and instead of doing that with your hands and with some manual tools, you'll do that on a computer screen with a mouse. And this might be great for teeth, but it's not robust or precise enough for metal parts that have to fit really well. So we implemented parametric planning. And we were inspired by industrial designs of cars, airplanes, buildings, rockets. And we want to bring the same level of design precision to dental restoration as well. And this is why we cannot count on the sculpting abilities of a certain technician. We must do it with mathematical functions, with algorithms, and you will see a short demonstration of how it's done right away. This isn't just an improvement. It's a paradigm shift in how we approach implantology and implant planning. And we set a new standard for accuracy and robustness. And this video, by the way, that you can see here, this is real time. We did not make it faster. This is the time it takes with the advanced automation that we currently have. And these abutments or similar abutments go into patient's mouth. Okay, you can see the abutments, and this is the verification jig, and the abutments are sent to milling, the jig is sent to 3D printing, and the case is ready to go to the dental clinic for placement in the mouth. Planning of such a case of 2 implants, which is quite common for retaining lower dentures, takes around 3 to 4 minutes in our system, which is a great advantage over any other software. So our vision for the future would combine patient data from multiple sources, from cone beam CT scans, intraoral scans, facial scans, and more, even functional scans that follow the movement of the jaw. And we will create a comprehensive virtual twin of the patient. This approach will allow us to plan, manufacture, and deliver the most optimal restorative solutions even faster. So it will make our work more efficient and more effective, and maybe even less costly for the dentist and the patient, even less costly than it is today. And we want to make this restorative planning accessible to every dentist. We don't want the dentist to plan. We want the dentist to send the data, the materials to us, to our servers, and our AI will plan the case and will tell the dentist, will present the abutments that will be manufactured. We want to achieve a completely automated process. And we will also want to be a one-stop shop. So the dentist will send the data to one place, and in the end of the process, they will receive a kit which includes everything they need to restore the implants, whether it's the abutments, the bars, the prosthesis, the bridges. They will have it all in a single box. And we want to rely on local manufacturing. We don't want to establish a manufacturing center that will have to send all the physical parts for every case overseas in a separate delivery. We want to manufacture the parts locally. So the only thing that goes from one place to another overseas are files that are sent online. And by this, we're coming closer to the end consumer, be it a dental clinic or a large network like the United States has, saving time and money and allowing the placement of the dentures much faster. According to the recent ADA Economic Outlook, which was published in December 2024, the key concerns of US dentists were staffing shortages, low reimbursement, and increased costs. AbraCadabra empowers the dentist to practice efficiently, predictably, and profitably. We reduce chair time by enabling single visit procedures that save valuable time for both dentists and patients. We minimize follow-up appointments and increase efficiency. We reduce costs and expand the market reach, delivering predictable results that mitigate risks and complications. On the other hand, for patients, our solution offers stability and confidence. Our magnetic retention ensures that dentures stay securely in place, while maintenance-free design eliminates the needs for adhesives or frequent adjustments. Our patients can smile, eat, and speak naturally, knowing that the restorations are reliable and aesthetic. And most importantly, it's very affordable. It's much more affordable than the current restorative solutions, and especially the ones aimed to provide fixed restorations. Now let's meet another patient. Here's S. And S is a special case because she's paraplegic. She can only move her neck and head. And she has a caregiver who struggled with traditional dentures and with putting them every time in her mouth and placing them on top of the snap-on attachments that were connected to her implants. Once replaced with AbraCadabra's magnetic restorations, S can now independently push the dentures into place and do it securely and repeatedly using just her tongue. So this innovation for S is not only functional, it's life-changing, and it saves her a lot of embarrassment. It saves her caregiver a lot of embarrassment as well, and they don't need to struggle with the dentures anymore. Our system has already been praised by leading dental professionals worldwide. They highlight its simplicity, functionality, and the ability to deliver fixed-like restorations with a low number of implants that improve patient outcomes. And these endorsements from dentists both in Israel and abroad reaffirm that we are on the right track to redefining implant dentistry. In terms of IP and regulation, so we already have an approved system by the FDA. We're approved by the CE and of course by the Israeli Ministry of Health. And in terms of IP protection, we already have 9 approved international patents in the USA, the EU, Brazil, and Israel, as well as additional patents in different stages of the process. And these patents cover our unique restorative systems, including solutions for limited interocclusal space and fractured implants, as well as innovative tools like our own healing abutment we call the Pathfinder. Now let's talk about the market. Let's talk about some financials. So the global dental implant market is growing at 9% annually, and by 2030, it's projected to reach $9 billion. Asia Pacific region is expected to be the fastest growing market, while Europe also shows significant market activity, particularly due to its aging population. And with our innovative solutions addressing unmet needs, we are poised to capture significant market share in North America, Europe, and the rapidly growing Asia Pacific region. Now, let's focus on North America and specifically on the US. North America has been dominating the global implant market, accounting for over 35% of the overall revenue in 2022. If we look at the US alone, 3 million implants are placed in the US every year in around 500,000 patients. And though the average American is well aware of their oral health, there are still 10% of the population, 30 million, that miss all teeth in at least one jaw. And they need a solution. And the solutions that currently are available on the market are either expensive or not good enough. Now, our system not only outperforms traditional restorations, and you have here a comparison between locator abutments, which are snap-ons for denture retentions, and our abutments. We also reduce costs by 55% if you look over a 5-year period. because we save money on the follow-ups, we save money on maintenance and on replacement parts. And by saving patients money without sacrificing the quality of work, we make the most advanced care accessible to a much broader population. Our business model is collaborative. We combine global planning, as I mentioned before, with local manufacturing. By partnering with regional milling centers, we reduce delivery times and costs while ensuring personalized service for clinicians. And these milling centers, these large dental labs in each area, whether it's the East Coast, the West Coast, Southeast Asia, and so on, the Middle East, Europe, they will serve as local knowledge centers, close to the end customer, close to the dental clinic, able to speak with them in their own language, understanding their specific needs, and consulting them on specific cases. So, in the end, this model drives efficiency and growth for all stakeholders, and we have a very good revenue sharing approach, which allows these centers to enjoy a share of profits from every manufactured part, as well as 100% of profit from the dentures and bridges, from the prosthetic parts they produce for these cases. So it means not only our business, but a lot of new business for these centers as well. And this is the strategy. So the dental clinic will take the digital impression, send it to us online. We will plan the case and send the design file back to the milling center in the specific locale close to the clinic. The milling center will manufacture the individual parts and models, package them with the standard parts previously provided by us in a large batch, manufacture the prostheses, and deliver everything shortly back to the clinic. So where we are and where are we heading right now? In the coming year, 2025, which has already started, we plan to enter the European Union and US markets and want to reach our first goal of 2,500 cases per year. And that would bring us to a revenue of $2 million based on an average revenue of $800 per case. In 2026, we plan to introduce a beta of our AI planning feature to enable our customers to fully automate the planning process while reaching these 2 million in revenue and expanding the markets furthermore. So if we talk about $800 revenue per an average case of 4 implants, then you can see that our financial trajectory aims at a projected revenue of $40 million after year 4, and we will be on track to scale globally while maintaining our commitment to quality and accessibility with our collaborative business model. So, sorry, to go one back. So according to our strategic roadmap, the first year will be focused on market penetration. And then as we scale up in years 2, 3, and 4, we will increase the revenues, but we will also become more cost effective. So our profits will grow, the profit share will grow, of the revenue will grow much more than its current percentage. And then by year 4, once we reach a large enough valuation, we'll be able to talk about either an acquisition by a larger company or an IPO and going public. As we move forward and expand, we aim to keep our costs and expenses low and increase our efficiency and profitability. You can see those here. And I will summarize by our current funding position and where we are heading. So our funding roadmap is that we raised $1.5 million in 2016 from angel investors. And since then, we did not conduct any other funding rounds. And now in 2025, we conduct our round A. And currently we seek funding of $5 million at a valuation of $25 million. And with the strategic roadmap that I outlined to you earlier, we plan to reach a valuation of around 180 to 200 million after year 4 and go public or to an M&A deal in that valuation. So the proceeds from this round of funding will be used, of course, for market penetration and business development in our target markets. They will be used for R&D of our AI product and for the building and expansion of our global clinical support center that will consult and plan the cases for clients worldwide. I'd like to thank you for listening to this talk. AbraCadabra is not just innovating implant dentistry, it's transforming lives. So thank you for your time today, and I look forward to partnering with you to shape the future of this field. And you please feel free to ask any questions or to contact me, and my email is right here at the top of the slide. So thank you.
Okay, Vladi, thank you so much. Very nice presentation. So we'll try to address a few questions that came in quickly.
Sure.
Can you say anything about payer coverage in your initially intended markets like the United States? Are you in discussions with insurance companies, or you expect just private pay for your implants?
We are currently not in discussion with any insurance companies in the US yet. So at first, we expect the patients to pay out of pocket. However, this solution is economical. And we believe that insurance companies, once exposed to that as part of our marketing activities, would want to include this solution as together with the traditional solutions like ball attachments or locators, and we are much better than those.
Does it make sense to pursue markets other than the United States that may have better dental coverage? I've heard that I think Brazil has pretty good dental coverage.
Well, yes, but most of these markets, the dental coverage provided there is public. So we can talk about the UK, for example, where the NHS would fund 2 implants to support a denture at the lower jaw. And entering the NHS in the UK is, of course, one of our goals. However, from my experience with public systems, this might take much more time than engaging with private insurance companies.
Okay. And then there were some questions about the economics for the dentist. So a dentist that wants to use your system, what would their initial cost be, and is it more or less profitable to do your implants versus traditional implants?
Yeah, so the initial cost, for example, for a case of 4 implants, so naturally they will have the implant cost, which might be $150 per implant, but they can buy it from anywhere they want. Our abutments would cost around $200 to $250 per abutment, which is comparable to the current snap-on solutions they have on the market. And then you have the cost of the denture itself or the bridge, which is also depends on the lab, but the manufacturing methods are similar to what you have with traditional cases. Now, the biggest cost reduction that we have is at the maintenance stage, because with the current solutions, The patients have to come every time, once in a couple of months. They need to either replace a silicone cap or replace a locator attachment or adjust something, or something falls out of place, or something sits too tightly and they need to release it. And all these parts and all these maintenance stages, over time, they cost quite a lot for both the dentists in terms of chair time, and an hour of chair time is around $400+ in the US these days. And of course to the patients as well, because they have to pay for it, and they have to pay for the parts. And we don't have those. Our parts, our magnets do not have silicone caps. They don't need replacement. And we don't have this level of attrition of the parts. We don't have parts that lose retention over time. So in the end, the cost reduction is maybe it's slight in the initial product, but it's very big. It's up to 55% over a 5-year period.
Vladi, if I can add something.
Yes, please, Danny.
The system is so simple that any student at the 5th year can do it easily and achieve an excellent result. Today, you have to use experts, which cost a lot of money in your clinic, and you can replace it with any GP that will listen or watch a video of half an hour, and we will be able to do it easily.
Okay. When were the first implants implanted, and how many patients have your implants today?
Okay, so I'll just need to stress that we manufacture the abutments, not the implants. So we placed our first abutments, our first prototypes, on implants of many different companies. The first ones were as far back as 2012. But this was with an analog, a non-digital restorative system that was used to be our prototype for the development of the current system. Now, with the current system, with the digital abutments, our first cases were placed in 2020, shortly after the first COVID lockdowns. And so far, we have hundreds of cases already placed. The system has been extensively marketed in Israel in the last 2 years.
Okay. Could 3D printing work for your abutments versus using milling centers?
That's a very good question. So 3D printing can work. Especially 3D printing in metal, of course. We can talk about SLM or similar methods. However, 3D printing will require some post-printing refinement, because, well, it looks worse than milling it.
Okay. And then maybe the last question, as far as your commercialization strategy, do you intend to hire your own sales force, or to rely on distributors or other ways?
We would like to rely on distributors. And as I mentioned earlier, we would like even these local milling centers that I mentioned before, we would like them to be our ambassadors to their local dental community.
Okay. Okay, great. Well, I think that brings us actually to a few minutes over your time, which is fine. Very nice presentation. Thank you for answering many of the questions that we received, and we wish you a lot of continued success. Thank you very much
so much
to the AbraCadabra team.